Shafiq Tinker is a man who passionately loves his job, so much so that his wife, who is 4 months pregnant, rarely gets to see him. When she went for her first antenatal visit, he wasn't with her.
By that time, I was when I went in the outside catering.
The couple doesn't know their HIV status as yet.
I think that next time we will go together and then test for HIV.
But there may not be a next time, something that the health workers decry.
There are very few men who accompany their women for antenatal services.
This situation means more work for the health workers, who have to persuade women to come with their husbands to hospitals.
Giving them invitation letters for their husbands and giving them all the knowledge why they should test with their husbands. And some have tried to bring them on other visits.
Uganda's First Lady Janet Museveni thinks this persuasion is uncalled for.
Omiringo mingi abashaija mutu disappointing jiri. Mbwenu ntero muranga, really I appeal to men to take responsibility again and take charge of your families and know that you have that responsibility, God-given.
But words have so far proved ineffective in changing these people's mindsets. The Reproductive Health Division in the Ministry of Health has developed a male engagement strategy with key interventions to bring more men on board.
The most challenging aspect that men are the breadwinners, and asking them to come for antenatal is sometimes being unfair to them. But we have tried as much as possible, to the extent even having antenatal clinics outside working hours, in the weekends.
All this is meant to stop the spread of HIV infections among newly born babies, encourage women to deliver in hospitals, and engage elusive men in testing for HIV.
Each health facility that is actually offering the PMT program, we recommend them to establish what we call family support groups, women who have already gone through the PMT services, where they share experience with each other, issues of disclosure, they discuss issues of violence. We also have the concept of peer mothers, peer fathers.
The incentives to win the men over are numerous.
We provide them health education for free. They provided HIV counseling and testing services for free. We test them for syphilis, we weigh them, we take their blood pressure, we refer them for circumcision.
With these incentives, more men are expected to come on board.
We talk about incentives and all as if for everything someone has to be paid. I think what needs to happen is, and I don't think that the fathers are looking for money or anything. I think what needs to happen is they need to understand how this helps them achieve what they always wanted, a healthy family.
Dennis Muhumuza is one of the few exceptional men. He attended all his wife's antenatal visits.
And proudly, as an expecting father, because she was my first kid.
He plans to do the same for a second or even a third child.
This is a modern time where you must go with your wife, because this kid is not a wife's kid, it is your kid, both of you, and you must be there for your wife.
Efforts of bringing men on board need to be intensified for women to continue with family planning methods, babies to be born free of HIV, safe motherhood to be realized, the improvement of the sexual and reproductive health of both men and women in general. According to the World Health Organization, 800 women die daily globally due to pregnancy and childbirth-related complications. This can be stopped.
My wife is 7 months pregnant. I went to the hospital with her the first time. We were tested for HIV and found negative. Since then, she's been going alone.
You have to go with her and listen to what the doctors say. Don't you know this?
I am not aware of this.
The authorities have observed that men have the final say on all family issues. They suggest the adoption of any intervention, even if it means health ministries in different countries, giving men incentives to get them on board. Florence, NTV.